Hello, ladies and gentlemen. Welcome to Triple N Media. I am Dr. Nik Nikam, a cardiologist from Houston, Texas. Today, we're going to talk about the COVID second booster vaccine effectiveness. How effective is the COVID vaccine? How effective is COVID vaccine in preventing Omicron variant? How long does the vaccine effect last? So, in order to look at this, the Israelis did a study, and we're going to look at that particular study. So, let us begin with the feature presentation. So, we're going to be looking at COVID second booster dose effectiveness. The New England Journal of Medicine on April 5th reported a study from Israel that looked at the effect of a COVID second booster dose in terms of reducing infections, in terms of reducing severe infections in the group that received only 3 doses versus a group that received 4 doses compared with a group that received only 2 doses. You can follow my green arrow here. The first group received the first booster dose. The second group received the second booster dose. They looked at confirmed infections and severe COVID infections in both groups. And here are some of the results. The confirmed infection per 100,000 patient days was 177 in the 4-dose group, which was half that of those in 3-dose group, which was 361. That means those people who had received only the first booster dose, the incidence of infection was 361, the Omicron variant, whereas that was reduced by 50% in the group that received the fourth booster dose, which was effective against the Omicron variant. However, in the control group, the infection rate was 388. So there is clearly a benefit in terms of reducing infections and severe infections by taking the second booster dose. Let's look at a little further. How long does the effectiveness last? And that's where the real question becomes unclear. In the first week, the reduction was there, like 1.5 ratio compared to the control group, which is the one that had the first booster dose. By second week, there was a 50% reduction or better in the group that received the second booster dose compared to the one that had only the first booster dose. But by the end of 8 weeks, the difference was very, very minimal. That means there is no question the second booster dose does reduce COVID infections and severe infections, especially with the Omicron variant. However, by the end of 8 weeks, the effectiveness of the second booster dose would wean off so that it would be no longer effective in preventing the incidence of COVID infections. So these are two major conclusions that we derived from this particular study. First, the second booster dose does work. There's no question. It is effective in reducing the COVID infections. It is effective in reducing severe infections, especially between weeks 2 and 6. They reduce the infection by almost 50%. They are protective against the Omicron variant. However, the protection may last for only 8 weeks. But this is just one study. We need to look at other studies to see what. But this is just one study. We need to look at other studies to see if this can be confirmed, or is there a population where the vaccine may provide prolonged protection. Should you take COVID second booster dose? I would say if you are over 65, if you are having multiple medical problems, you should consult with your physician. Let me underscore this. You should consult with your physician and see if taking this vaccine, even if you get protection for 8 weeks, is it worth it? and then you and your physician need to make a decision as to whether you should go ahead and take the vaccine. But if you are at a high risk for COVID infection, and if your systems are compromised with COPD, heart disease, diabetes, then even that protection may be a lifesaver compared to the minimal protection you get from the second booster dose. Thank you so much for watching this presentation. We have numerous videos, educational videos on COVID, heart disease, diabetes, heart healthy lifestyle, and senior healthcare. Please do watch them, and please do subscribe to our YouTube channel, and I will see you in the next video. Thank you so much.